take one off.
If I go with that little shape, it never had.
Okay, is that better?
Yeah, it's fine. We have one that's just showing your name, and then we have one that's showing you.
Right, it so it's all crunchy.
Okay.
And could folks who are not speaking mute themselves and unmute when you're speaking, because someone's TV's on in the background and I hear something. Okay, there you are, just you. That all worked out.
I'm gonna have to take it off of my computer and just do it on the phone because it's not working right. Because the audio is only on the phone.
Okay.
Okay, so never mind. I'll just go in another room. It's easier. Okay, so that's what happens when you deal with old people. Okay. So
Well, let me just say a couple things because we are getting started. So I'll just say hi. I'm Samsarah Morgan, Executive Director of Oakland Better Birth Foundation and Shiphrah Circle Community Doula Program. This is a Tuesday practice meeting. And this month we have been focusing on the issue of inductions. And we are very proud to have with us as a guest, Maddy Oden, who will engage with us in a conversation around inductions and specifically the drug Cytotec or misoprostol or miso, all three being the same drug. Welcome, Maddy.
well, thank you, and thank you for having me. So you guys have seen the documentary, Life to Death in 10 Hours. Pretty much, well, obviously the whole thing was what happened. But primarily, one of the few missions of the foundation that I formed after my daughter died is informed consent, because they never told us anything about Cytotec. They never told us the side effects. They never told us that it wasn't approved by the FDA. My daughter actually knew this. I found out after she passed from her husband, based on a childbirth class. But all they said in the childbirth class was that the FDA didn't approve it, but that it was standard of care.
Right.
So pretty much, and I'm a very natural birth oriented person. It was actually difficult. This was in 2001 for my daughter to believe that I had 3 babies with no drugs and pretty much all by myself in the room. First time I was single mom, didn't have a partner, husband, whatever in the room. And the second time was in San Diego, and that was in 72. And the father didn't come in the room, so that was all by myself. And of course, they weren't dealing with me at all, which in the long run, in retrospect, turned out to be for the best. So anyway, so I didn't know anything about Cytotec. And when I asked them what it was, they said,
For a moment. Could everybody mute themselves who wasn't speaking? Thank you. Go ahead.
Okay, so the main thing about any drug, any intervention that the hospital is offering to the mom is that you need, as a doula, as her support person, you need to either do all that background beforehand if you have enough time, or if you just start seeing the mom like the first time and it's the birth, which happens, as you guys know, you know, you need to ask them to tell the mom exactly what all the side effects are, because obviously they have a right to know, but the doctors don't tell you. Because if they ever told you all the side effects of Cytotec, nobody would ever agree to use it.
Exactly.
Yeah, so they do what they do lots of times, which is not give you information, but because of the state of mind and the emotion and everything that's going on when you're in the birth, they just go, oh, it's very safe, we use it all the time. So we're supposed to believe them because they went to school for a long time. In terms of actually what happens with Cytotec when it's used, I don't know, have the doulas done births, or they haven't done any births yet, or?
It depends on the doula. Some have not.
Okay. In terms of Cytotec, the way it works is it's kind of like Russian roulette. So either it'll work and you'll just get contractions that don't kill you, literally, or it won't work. Absolutely nothing will happen. The contractions won't start, and then they escalate to compiling more interventions. So they don't use Cervidil so much anymore, especially in the Bay Area,
Right.
my knowledge. So what they use is the Foley balloons, and then they use PIT. And then, of course, your body is either it's been such a long time, or your body is so raked over the coals from being mechanically induced with the contractions that you actually want an epidural, which is something that you said you never did want, because you just can't do it anymore, because dealing with the contractions and increasing pain, even though it's good to eat while you're in labor, you don't want to do that, because you never know when it's gonna you're gonna get one of these surges. So the statistics in terms of Cytotec, they do use it all the time because it is very cheap. It's 25 cents a pill. They cut the pill in quarters, and they give you a quarter of the pill every 4 hours. Right now it's just up to 3. It used to be 3/4. It used to be way, way, way more than that, but they were getting a lot of uterine ruptures, a lot of amniotic fluid embolisms, which is what my daughter died of, a lot of just incredibly painful, searing contractions. There was a Dateline piece that was done literally a month before my daughter died on Cytotec, and they had about 6 women there who lived through a Cytotec induction. One, I think her baby died. Another baby was brain damaged. Another woman had a uterine rupture and had to have a hysterectomy. Another one almost bled to death. But they all said the same thing, which was that the contractions were so excruciatingly painful. One said it felt like her entire uterus her entire insides were just on fire, which of course was her uterus rupturing. So yeah, so the information is out there. The drug company itself listed 12 horrendous side effects and said don't give it to pregnant women, but because it's so cheap, and when it does work, it works fast. And it also has a shelf life of forever, so you don't have to refrigerate it. It doesn't get damaged by the heat or the cold. So yeah, so they love it. I did actually just come up with an article this past week that was in PubMed about a small study, because they don't have big ones, where Cytotec and what else? This other cervical ripening agent, which is called an extra amniotic saline infusion, and they usually use it. You ever heard of that, Samsarah?
That's new.
Yes, it is. They use the letters easy, E-A like apple, S like Sam, I. And yeah, and it's interesting because, of course, they compared Cytotec and this easy thing to see which one had the same outcomes that they're looking for in all of these trials. So it was which one had the least horrendous side effects, which one worked the fastest, which one was the cheapest. And as it turns out, interestingly enough, the conclusion is that this easy cervical ripening agent is safer and more effective method for cervical ripening.
What is it actually? Does it say?
Yeah, it's called, well, the three that they used was Cytotec vaginally, a laminaria, which must have been cervical, and then the easy thing, which is extra amniotic saline infusion. So in my mind, they literally are shooting amniotic fluid right up the cervix. And
Wow.
yeah, so it's very bizarre.
It's
just
as
one-
usual
one-
as usual in gynecology.
Exactly. I was going to say one more bizarre thing that they're doing to women. Yeah. Anyhow, so they came up with this conclusion.
The study there, Maddy, they're still inserting the Cytotec in vaginally in that study that you're reading?
In this study, yeah. In this study, it's vaginal.
Are there any studies on it taken orally, which is what they seem to be doing now?
Yeah, they're comparing them orally to vaginally. In the studies that I've read, I'm sure there are more studies, but they compare them vaginally to orally misoprostol, and they're looking for the same thing. Which ones work faster, which one has less adverse side effects. And the studies that I've read for those two things, basically they conclude that there is no difference. They both work the same speed. They both have the same side effects, which if you think about it would make sense. It's just, I would think that the oral misoprostol takes a little bit longer to work because it has to be digested through your digestive system, then go through your blood. Whereas vaginally, it just dissolves and there you are.
Yeah, I agree with that. That's been my experience, that when they were inserting it, it worked like that. And then swallowing it, it takes a time to build up and then it kicks you, if it works at all.
Right. And I've had clients that have been given vaginal misoprostol before I got there. So obviously, yeah. Anyway, and for them, thank goodness, actually nothing happened. I just pray through the whole thing that it doesn't do any good. And then when the doctors come in and say, well, now we're going to do this and that, then the mom can say, no, let me try walking around or whatever. So you can kind of keep them at bay, and try to go into labor yourself.
Right.
The other thing that happens that's not talked about a lot is the postpartum hemorrhage that misoprostol causes. I've gotten letters from women that have been given Cytotec that literally have almost died from postpartum hemorrhage after the Cytotec. The baby's born and then they just start bleeding profusely. They remember nothing, and it's either the husband or the partner or the lawyer that gets the records that tells them what happened.
Right.
And it's really is criminal. I mean, there's no other word for it. It's just criminal.
I think one of the most frustrating things that I found as a doula, and I'm going to do a better job of introducing, like Maddy is the founder of the Tatia Oden French Foundation. She is also herself a doula. So she's speaking from a twofold place, a powerful place to be able to give us this information and to participate in this talk. And one of the most frustrating things for me as a doula is to, get every client that I have gets a copy of your documentary. Every single one. Every single one. They get a copy of your documentary and they get a copy of Ina May's brief talk on Cytotec. every single one. And then the doctor goes, well, we're going to induce you because of this new fucked up study. Excuse my language, I have to watch that. Because of this new stupid study, it's perfectly fine for you to have your baby at 39 weeks. And, you know, let's just get going. Let's go meet your baby. Let's go have your baby. And then we have to remind them, okay, well, if you're going to do that, if you're going to say yes to that, you need to ask them how they plan to induce you and what's the procedure. Because folks who just show up for that, yeah, you're going to induce me. They have no idea what that means.
Right.
And so, and then the doctor says the word Cytotec or misoprostol. I've had people, I've had nurses at Altivate say to my clients, the client says, I don't want Cytotec. And they go, oh no, we have misoprostol. No, it's the same drug, dear. Oh no,
Yeah.
we don't have misoprostol. We have miso.
Misoprostol, Cytotec, and vitamin C. Vitamin C, right.
They call it vitamin C.
Yes.
They will tell the client she's being given vitamin
Yes.
C.
Yes.
They will tell.
That's what they call it. Yeah. That was my reaction the first time I heard that too. I've never heard a doctor say that to one of my clients, so I haven't witnessed it, but that's what I've been told. By a nurse, by a labor and delivery nurse.
Wow.
Yeah.
Now, firstly, we should be suspicious of a doctor recommending a vitamin. Medicine doesn't even recognize that vitamins do anything.
Right. Right.
So that automatically we should be suspicious about that. But what a deception.
Well, the whole thing is deceptive. The whole thing is deceptive. I mean, to say to this day, you know, it's perfectly safe. When when January, I got back from wherever I was, and I had three emails, which is real unusual, in 1 week about women given Cytotec that had horrendous outcomes. In fact, one, the husband had to write me because she was just still crazed.
Bless her heart.
Yeah.
Bless her heart.
So I know, and they were from all different places in the country. So it's like all over.
Are these recent emails?
Yeah, January, this past January. This is what is this? June? Yeah, right before the virus hit.
But see, another concern is now, of course, basically doulas are banned from doing their work.
Right. Well, face to face, yes.
Well, you know, it's really hard when you don't have the doula right there in the room. The hospitals, the milieu in the hospital changes when the doula's not there.
True.
Yes.
True.
Yes, we're still there. I'm on the phone. We're all that stuff.
Right.
But I've been told by labor and delivery nurses who I trust that they see in their various hospitals, we're talking Kaiser, Oakland, and Alta Bates, a big uptick in inductions and C-sections.
Oh yeah. And in inductions, African American women and women of color are induced way more than white women. Way more. And that's been historic. And hence the outcomes of the birth itself for the African American women of color is much worse because of the side effects of an induction. You may walk out of there with a live baby and just take a deep breath because you're out of there. But what the labor was like as opposed to what it could have been like, you know, especially if you take a woman who's not high risk. Correct. And end up basically making her high risk because of the induction that her body just wasn't ready to do, you know. Wow. It's criminal. There's no other word for it.
It just renders me speechless. It really does. So what is your what's your foundation up to around this issue? How can we help the foundation?
Well, basically, you know, we have the website, and I'm sure you've given them the website. And on the website, there is information specifically about Cytotec. We push basically the information because it's an educational website. We push the information on the FDA alert that we got the FDA to do on Cytotec. We have a sheet that is printed on the website. If not, I can get you copies that I think you've seen at one of our panel discussions in Oakland. Anyway, that lists, that has a copy of the letter from Cyril, which was the original manufacturer. And they haven't changed the combination, to my knowledge, of, you know, how they make the drug, of all the side effects. And on the other side, it has the FDA alert where the FDA says, you know, it can do this and this and this, up to including death of the mother, death of the child. And we have not endorsed it as an inducer for women in labor. I mean, the FDA still has that on its website. So handing out that information, stressing to moms, there's a lot of information now, thank goodness, online. A lot of people have articles out there that are incredibly well written. Dr. Marsden Wagner, Ina May, David Goodman. Yeah, and even though these articles may be dated, they're still totally valid. The only thing that's changed is, to my knowledge, is the small studies, because they're not going to have big studies. They're not going to have NIH studies, because in NIH studies, you have to have thousands and thousands of women, and you have to give them pages and pages and pages of all the possible side effects. And what woman in her right mind is going to be pregnant at any stage and read, well, you might lose your uterus or your baby or your own life, or what, or the baby might be brain damaged, like one of these women in the Dateline piece. So nobody's going to sign on to that, right? So they don't have NIH studies. So all those studies are very small, and a lot of them are online. Some of them are in the Lancet. World Health Organization has some out. So the biggest thing that everybody can do is just inform yourself well on Cytotec, first of all, and then print up your own information on it, you know, with the site of where you got it from. You're more than welcome to take anything you want off the website. My website, that was the purpose of it. So, you know, and just hand it out. That's what I do to my clients. We also have on there, I was on the Public Health Commission for Alameda County and the head of the Maternal Mortality Committee on the Public Health Commission for a few years. And we produced a leaflet, both in Spanish and in English, that has questions, you know, that you can ask your doctor to get a better idea of how they think about different things, whether it's C-section or induction or your diet or whatever. And then it also has an insert of 6 interventions that are used during labor and delivery, or that could be used during labor and delivery, some side effects. And the purpose was to encourage the mom to speak to the provider about their feeling, get information from them, but also to go online and look it up themselves. And you can download those things off of the website also. Yeah, we're doing some different things with the website right now. So if any problems, just contact me and I'll get you a copy of it. It's all online, so it's all free. You can just, you know, copy as many as you want, or none, or whatever. But it's the information. That's the biggest thing that people can do, is just help spread the information about it.
And for folks to know about it, and for sisters to talk to sisters, and friends to talk to friends, and just because of the way I present it with my clients is like, I'm not here to tell you what to do.
Right.
But I will say, my opinion is strongly say no to this drug.
Right.
That's how I say it. You
yeah,
know?
because with Cytotec, once it's either inserted vaginally or taken orally, it's a done deal. It's not like, you know, PIT where you can turn it off, you can turn it down. They do that all the time. It's not like Cervidil when they used it, you could pull it out, and the balloon, you know, you can pull that out, the Foley. But Cytotec, you just got to ride it out. And there's nothing, terbutaline, nothing that they can give you to make the contractions any less. And I say this from experience because, you know, they tried that with my daughter up to and including morphine, and nothing was working. So, yeah, and who wants morphine when they're in the middle of labor?
Oh, really? And there's the thing too, I mean, the first client that I ever had that got Cytotec, and I have made sure that it hasn't been that many. But the first time when I saw the contraction pattern on the monitor, it was the most terrifying thing.
Right, right.
I clutched my chest.
Right,
did
those
not look
contractions are
normal.
huge. They're huge. Yeah,
It
they're
was
huge.
not normal. There was nothing normal about what was happening in my client's body.
No.
And as I shared with my students last week, that client had her placenta used, which is one of the side effects. And they had to have the surgeon come in and scoop out big chunks of her placenta in the L&D room. And
Mhm.
me and her family were all slipping all in her blood as they were doing that.
Oh, wow.
Luckily, she wasn't planning to have any more children. And she was a monster because she went through all of that without any pain meds. She went through all
Oh
of
my
it
God.
and birthed a beautiful baby boy. But there was that. There was hemorrhaging. There was a fused placenta. It was a wreck. It was a mess.
And they gave her Cytotec
Oh, yeah.
from Cytotec.
Yep. Yep.
So I have a question. I just saw Tora get on. So this is for Tora, if that's okay.
Oh, sure.
Okay, so in that, did you hear that story, Tora, that Samsarah just said?
No, I just got on. I realized it was 7:30 and I've been out of it today.
I'm glad
Okay.
you're here, Tora.
Thanks.
Well,
I got the gist of it that a patient got Cytotec, had a postpartum hemorrhage and a retained placenta.
That's the deal.
okay, so here's my question. In that case, since Cytotec is used successfully for postpartum hemorrhage, what would they give? Would they give her Cytotec again?
Right, but they usually give like 1,000 micrograms rectally for postpartum hemorrhage. That's how it's given.
Okay.
So they use it to start the problem and they use it to cure the problem.
And then you don't have a uterus when it's done, right?
You still do, yeah. We give it to a lot of patients in postpartum hemorrhage. Usually we give them, we'll start with Pitocin, then Methergin, and then Cytotec. And then if that doesn't help, there's a medication called, it's a IV medication, Texas, I can't remember the name of it. It's something new that we've just started using like in the last year.
There are some midwives, even home birth midwives, that will use Cytotec rectally to postpartum hemorrhage.
For postpartum hemorrhage, yeah.
Right.
Not to reduce it.
Something relatively non-invasive, and you can give it right away. Right.
Okay.
So, yeah, I mean, that's postpartum is a very different.
Right. But yeah, I know.
But it's just, what I'm responding to is, you know, I'm looking at the finances of being able to charge how much they charge per pill.
Right.
Oh, they charge way more than 25 cents a pop.
Believe you me. And if we're talking about a person that if they had left the body alone, left this body alone, and it would have had its baby in a few days on its own without muss or fuss, that's the issue. We're not talking about people who are in some kind of dynamic crisis where you need to get the baby out fast, and so you going to the biggest degree to make that happen. We're talking about people with 39 weeks, and that 39 weeks is a guess.
Right.
And there's some people, when I started out this gig, they didn't even bother you until you got to 42 weeks.
Right. Right. Right.
You get to 42 weeks before they may be starting to sweat a little bit. Now they're like, 39 weeks. And so on tight closed cervixes, and of course, on a tight closed cervix, you really get close to that 50-50 C-section possibility. Why do that on perfectly healthy people? This is my problem with medicine across the board, and especially in OB or maternity. If someone's having a problem, okay. But, perfectly healthy woman, no group B strep, no gestational diabetes, no preeclampsia, nothing, just pregnant. Leave a baby.
Exactly. Exactly.
No, they can't do that.
They literally can't. It keeps them up at night. They get this domination and control. It's like this is exactly what patriarchy looks like. It's working fine. I don't need to mess with it. I don't need to come and fiddle with it.
Right. Right. Right.
Person got to 39 weeks. I mean, why don't we applaud her and say, whoop.
Right.
We'll see you in the next 10 days, girl. You're gonna have that baby,
Right.
You'll be in here breathing hard and it's gonna be great. And it's denying people, you just think of course, the potential of the loss of life, but also the potential of the stellar feeling of being able to just push your baby out onto your own skin.
Exactly.
The bonding with your child that you're able to do because your central nervous system is clear and your uterus isn't exhausted, so much is being robbed from birthing people and their children, and we still don't know the effects on these babies. It's the stronger contraction.
That's the other thing. No studies. I have read no studies, no long-term studies in the almost 20 years I've been doing this, of what the effect is on the babies. Nobody goes back and asks them any questions.
Right.
Of any?
See results in the kids. In the past 20 years, we all know, hanging around with young children, that young children are very different than they used to be.
Right.
In lots of significant ways.
I want to respond to a question I just saw.
So,
that how can you force a study? One of the things that we tried, my foundation tried to do with the FDA was we had a petition to them to see if they would do a centennial study on Cytotec, and it would be relatively easy because, well, first of all, the only negative outcomes that they know is when a provider, which they usually don't do, send in a MedWatch form to tell them, okay, this happened, this happened, this happened. So like in my daughter's case, it would have been the doctor who said, oh, I gave this woman, Cytotec to induce her labor, and she died and the baby died. And so then, the FDA would have that on record, CDC would have that on record, but that doesn't happen. So the MedWatch forms is the only thing that they have. And we petitioned them to do a centennial study where they would pull all the records of women that were given Cytotec inductions from all the hospitals, and they don't have all the hospitals in the country, but they have certain hospitals, a lot of hospitals, that do labor and delivery, that have electronic records, that have signed up with the FDA, to let, I guess, the FDA look at these records. It took them almost 2 years for us, and because we just wanted them to do their own research, right? Use the records, find out for yourself, not from these little 200 people studies,
right.
what the results are. And it took them 2 years, and they said, no, we're not going to do the study. And I'm just like, wow, this isn't even going to cost anything. It's all computerized, so they won't do it. So the reason that they gave, actually, they didn't. I would have to go back and pull the letter that I got from them, but I don't recall them giving us
You don't
any
have to give a reason.
reason. No, they don't have to give a reason. They're the man, right? So they don't have to give a reason. And they just said, we're not doing it.
Because they probably looked at the data and saw what it would show, and they were like, we're not.
Well, I think, you know, all of these big institutions, the FDA, unfortunately, the CDC, they're all very, in my opinion, influenced by lobbyists, by the pharmaceutical lobby, by ACOG. And ACOG and the pharmaceutical lobby, I know from personal experience, because we've also approached them,
Right.
you know, don't want you to go near Cytotec. It's too cheap. And, you know, for the people that it works for them, and they don't want to touch it. And they just totally dismiss all the times that the babies die, or the moms die, or they both die, or you have uterine ruptures, you know, or amniotic fluid embolisms that they live through, or hyperstimulated uteruses, whatever it is, or, you know, the baby's heart rate, all these things that, in my opinion, you know, and Tora really should weigh in on this because she's much closer to it. But in my opinion, all of these things, if you force your body to go through anything that has a side effect like Cytotec has the possibility of doing, there has got to be some damage, long range. Babies being slammed around in that birth canal because the contractions are so violent, and they do come out with brain damage. The ones that don't register brain damage on somebody's scale, however you register that, you know, who knows what happens to them because they don't do follow-up studies.
Yeah, I mean, it's a shame because like they can say, oh, it's all anecdotal, so we don't have to pay attention to that. So I can just look back on all of my clients and see how many of the kids ended up with like sensory problems.
Yeah, like that. But they don't,
Talk of them.
and nobody follows through, because at least with my clients and people that have wrote to me that have had Cytotec inductions, they're just glad to get the hell up out of there. I mean, there's one woman, you know, whose records we were given, and it was really difficult to tell if it was the Cytotec that caused all her issues. But I mean, I certainly couldn't tell because I'm not a medical person, but I wouldn't be surprised. I wouldn't doubt that it didn't have anything to do with it. She might have had some other underlying medical problems that got exacerbated by the Cytotec and the intensity of it.
It is an intense ride. I mean, as a doula, supporting somebody who's on Cytotec or supporting somebody who's just having labor, it's such a completely different experience. It's visceral. You can see the difference.
Mm-hmm.
You know, and of course, you know, for most people, having a baby is a challenging thing, but not being able to catch your breath and not being able to find your center with it, and the drug working so fast that your body can't make the natural endorphins fast enough to help you cope with it. So it is a huge setup for the need for further pain relief, because you actually are in pain. I always talk with my clients about, well, you know, we need to find another word for labor or discomfort, because, you know, I've had a broken leg and I gave birth to 3 kids, and I'd rather birth another kid than have another broken leg. Right? So we have to have another word for childbirth discomfort, right? But I really believe that when you're induced, you're in this place that is painful, you know? And I've seen my clients be able to ride out and find their way somehow with PIT. But the misoprostol is a whole nother bag of tricks.
It is.
Much harder to find a place for your humanity with this medication, to let your humanity work for you.
Well, Dr. Wagner told me that in '99, when they started using it in the US, you know, they were using 100 micrograms.
Yep.
Now they're using 25 at a time, but 100. And, you know, the adverse effects were just
Through the roof.
Yeah, I mean, and really, 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 really horrendous.
Well, I can tell you they're only giving 25 if it's vaginally.
Uh-huh,
They're giving 50 PO or by mouth.
uh-huh.
And after 3 or 4 doses of 50, if it's not working, they'll give 100 by mouth.
100 more.
Seriously.
100
Wow.
each dose.
Wow.
Every 4 hours, you get a dose. That's how the order is written.
So well, Tora, don't they think that if it's not working, they should just, well, obviously they don't. Never mind. I'm not even going to ask the question.
there,
I mean, I don't get it.
there have been a couple of situations where I've had a patient who, so for those of you who don't know, I work in labor and delivery.
It does.
Are in Berkeley.
These are our favorite nurses.
Yeah, thank you.
Sure.
And we give for patients who have unfavorable cervix, or what we call a less than 8 Bishop score. That's a score we look at how dilated they are, how effaced they are, what station the baby at. You know, if the cervix is closed and tight, it's recommended that they get something to help the cervix efface, which is usually Cervidil, which is the prostaglandin insert. And I like Cervidil because you can always remove it.
Right.
It's attached to a string, so it's placed inside the cervix. So if the patient has too many contractions, or if the baby starts having an adverse effect, you can just pull it. While once you give them Cytotec, there's nothing you can do. You know, once they've taken that pill or half a pill, and the fact that we cut the pill ourselves.
So it's not precise.
Right, it's not precise at all. So I've asked a couple times, why don't we just have the pharmacy prepare a 50 microgram dose? And I was like, oh no, it's easier if you guys do it. I'm like, why is that easier? Because we used to make our own Pitocin bags. Like after delivery, you put 20 units of Pitocin in a regular IV, 1,000 liter, 1,000 cc IV bag. We used to make our own, but then about 4 years ago, the pharmacy started making them for us. So we just get them out of the Pyxis now, because there was a problem with the dosing, you know. So I'm like, if the pharmacy can do that, they can cut a pill in half.
Exactly. And have the little precise cutty thing to cut it with.
Right.
Well, you know, even if the pharmacy did that, because the pill isn't meant to be scored, the amount of chemicals in one quarter still would be different than the chemical, or could be different than the chemicals in another quarter, because it's not supposed to be scored.
Right.
So it don't make no difference who cuts it.
Right. Yeah, because you have no idea how much medication. And it's the same with the Cervidil. Sometimes we have Cervidils that work really effectively, like we get a really good batch. And depending on how much prostaglandins are inserted, who, you know, saturated the Cervidil, who knows? So it's a guessing game, regardless.
It is.
Pitocin. You know, some people respond to 1 milliunit of Pitocin and have a baby, you know, in a few hours. Some patients get up to, there's a new protocol that they're going up to 30 with Pitocin. I was like, what? Because I only work on the weekends, so stuff happens during the week. I'm like, I come to work and things have changed.
Like, what the hell's been going on?
Wow, really? I'm like, no, I'm not doing that. Sorry.
How many hours, Tora? Or are they just looking at the strip
They're
to
still
jack it up to 30?
there. Yeah. So you go up by 1 or 2 every hour, every 30 minutes.
Right.
Until you
So
get a good pattern. But I think the problem too, especially during COVID now, that I've had so many patients who've been on Pitocin for so long that I come on and patient's been on Pitocin for 24 hours.
Oh,
No break, no dinner, no breakfast, no lunch, no shower, because you have to monitor the baby continually while the patient's on Pitocin. So I was like, well, why don't we turn it off for a couple hours, let the patient have dinner, take a shower, get up, walk around. You know, there's just been so, I don't know,
what's the logic behind that?
nobody's advocating for patients. Nobody's looking at the big picture. When the nurse comes on, you know, it's an 8-hour shift. When the nurse comes on, patient's been on Pitocin since 10 o'clock this morning. I'm like,
So you're saying because nobody's there and because the patient doesn't say, I don't want to take this stuff anymore?
oh, the patient never
They
said.
No, you're right. But in COVID, if we're not allowed to be there and or we don't get enough time with the patient to tell them, look, you know your body better than the doctor, than the nurse, no offense, you know, and you just tell them, I'm done with this.
Right.
And they have to stop. If we don't do that ahead of time, then you're telling me they just let that stuff drip?
Yes.
They
and
do.
kick them?
Yes, they do. Yes, they do.
Wow.
And so
Wow.
the deal too is that even when they are told, they will let that happen. Because my clients are told that Tora was out, joined us, you know, after I said, every single one of my clients sees Maddy's documentary on Cytotec, every single one. And it's still very challenging for them when the white coats and the scrubs are surrounding them to say no, even though they know. And this is something that I think we have to look at as women, as people. And yeah, I think the shenanigans would be cut definitely if I was present in the room.
Mhm.
But there's something about the process of being in the hospital. You're scared and you want to trust these people. You want to trust them. And you, in the back of your mind, it's like battered spouse syndrome.
Right. Right.
He didn't mean to hurt me. He'll never do that to me. Is the last thought of the last spouse that was beaten to death. Right? No, she wouldn't do that to me. Right? So, and it's the same thing. They're like, I love my doctor. Like, oh my God, y'all.
Well, luckily, we have had some patients push back against this. Patient was in for like 2 days. They did everything, miso, Pitocin, blah, 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 and nothing was working. So the patient says, can I go home?
Yes.
Yes.
And your patient went home.
The patient went home.
Yes, I was just going to ask if that's possible. Can you just leave?
Yes.
It is possible.
Oh yeah, you can get out of there.
As long as they're not having problems with their blood pressure,
Yeah.
as long as their bag of waters is not broken,
That is a
Well,
unique
that's
and
right.
brave individual right there.
then they can go home.
Yep.
Did they make them sign against medical advice?
Oh, sure.
Only if they go, they do have to go if they're going, but if they talk to their physician and say, this is what I want to do, and the physician writes an order for them to be discharged,
Then they don't have to sign AMA.
then they're not able.
But otherwise, they can sign AMA and they can get out of there anyway.
Right.
Yeah. Okay.
And then just a big hoorah for that patient.
Right.
Big hoorah for that patient.
Yeah.
That's
They come back like 4 or 5 days later in labor and have a baby.
right.
Right.
Came back, hear that, my beautiful Doulas, came back 5 days later and had a baby.
Yeah. I've seen it happen like twice in the last month.
Wow. Last month.
That's really encouraging, I gotta tell you.
Yeah.
That's really encouraging. You
And
know,
sometimes, you have to kind of drop a hint. Have you thought about just going home? Sometimes, but I
And
had
even with COVID, even with COVID, you can do that. You can do that if you're on the cell phone, if you're on the, the regular phone or whatever. You can put that seed in their head.
Right.
Absolutely.
It's gotta be their decision.
Right. Right.
But that's the thing. I mean, it's got to be their decision, and you hold your breath and start praying. But like,
Right.
if the doctor's just itching for you to be induced, and there's nothing medically wrong with you,
Exactly.
then you could, to avoid the whole scenario. You're like, well, what are they going to do? Like, what are they going to do? You think the cops are going to come to your door? Well, we got to be careful because we'll soon live in a world where that sort of thing might happen. But right now, today, they're not directly going to come knock on the door and drag you out kicking and screaming to induce your labor. So go home. Oh my God. Go home. Wow, that made my day to hear that.
Well, good. Those people like us, you need to always make that part of your education for your
Exactly.
tell them that, there is no reason why they have to stay in the hospital.
Nope.
Unless they have an underlying medical issue.
Right.
The baby
Right. We're
doesn't
talking
look good otherwise.
we're talking low risk,
Right.
completely healthy, no issues going on person. Yes. And my mantra with my clients is, you are in charge of you at all times.
That's right.
You are in charge of you.
That's right.
Not me, not the medical people, you. Not your husband, not your partner, you. What do you want to do? What does your instinct say?
Yeah.
You should do for your body and your baby.
That's right.
And then I'm there to support that, what comes out of my client's mouth, and I'm there to support that, because sometimes there's such an intimidation factor of being in the hospital.
Oh, and some doctors are really good at intimidating patients and staff. And we won't name any names.
And now the intimidation is even worse.
Right.
I mean, when you can't have anybody there, and or you got to decide who you want there between, your doula and your mom, or your doula and your husband, or your doula and your partner, or whatever. And I mean, it's much worse. It's much worse.
Let me open things up. Does anybody else have any questions that you want to ask? If not, we can just go on.
I have a question about Cervidil and why more places don't use that. Just because of the cost?
Yes.
That's what it seems like.
The cost is, like, I've been told, $250.
Compared to 25 cents?
Yeah,
Right.
to 25 cents.
$200.
Yeah.
Can I say something about the cost, Samsarah?
Please.
So, like, hearing, thank you, Maddy and Tora, for being here and sharing so much information. And
Definitely.
hearing Tora describe, like, the increasing intensity of dosage until moving on to something else, and then also what Maddy said about, like, the few studies that do exist. I was looking at some of this before our Zoom today because I just knew we were going to be talking about this, and I wanted some familiarity. And when you look at those small studies, like, none of them are over 1,000 people.
Oh, they're not even close.
And I think what's important for, like, all the students here, and, like, considering all of us as lifetime students, like, when we look at the research that is used in the US to, like, determine attitudes and practice and stuff, look at what the research is, what the question is in the research. Because when I looked through those titles, it wasn't what is the risk of using misoprostol to women, and what do women have as negative or positive experiences, and what is their long-term health, and what is their short-term acute, like, morbidities. The question is, does this drug work to make labor happen in 24 hours or less?
That's all they care.
That's all they care about.
What is the cost of the 9 to 27 people in a given, what is the cost of those 9 lives to the system compared to the cost of more births being within 24 hours? And that's what they use to say this is effective, not this is okay and safe. They say it's safe enough because the cost of this number of deaths does not outweigh the speed of this number of births.
And
so when
that's corporate patriarchy, right?
you have to ask.
Right.
Forgive me for cutting
Right.
you off, Jessalyn.
Right.
But that is just it. Women's lives mean shit. It's all about how much money is being saved by the corporation and how much money is being made by the corporation. That's what matters. That's what they're looking at. And so we got to take care of each other and ourselves around this, you know? And so it's one of those things where you hear your friend being induced, you all definitely get to speak to them about this and point them to the Tatia Oden French Foundation website where they can get information. So it's not just you, because patriarchy has us so screwed up in the head that we don't believe each other. If we don't see it on the computer, it's not true.
True.
But
Right.
we'll believe the friend that tells us the horrors of childbirth story. That friend will believe.
Right. Right.
Well, there was a really interesting study I read about 4 months ago, and it was talking about how synthetic oxytocin causes problems in breastfeeding for women
Definitely.
who had lots of Pitocin.
Definitely.
And I've noticed, I teach nursing students also. I've noticed in the book they use it interchangeably, but I tell my students it's not the same.
It's not.
Oxytocin and Pitocin are two entirely different things. So there was this study that talked about women who got a certain amount of Pitocin in their labor had more problems producing their own oxytocin, causing letdown issues and breastfeeding issues. But it makes sense.
Definitely.
Think about it physiologically, how if your sensors are saturated with synthetic oxytocin,
Yep.
it's not going to make its own oxytocin readily.
That's right. It won't know how.
Right. Until
won't
that
know
until that Pitocin is out of their system, you know, which could take days when you're trying to establish a milk supply.
That's the deal.
Born, it could be all detrimental for everybody involved.
And no one is telling the moms, unless you're my client, you don't get told that that's a potential side effect. And then you think the baby's not breastfeeding well, and you're looking at, you know,
Right.
lip
right.
tie, tongue tie, everything but the fact that you're on Pitocin for a day and a half.
Right.
You know, so let's stop and take a look at that. You know, yeah, there might be things that you have to do. Sometimes people do need a medication, and so if you have a medication, that's okay, but then you need to know the side effects and you need to know how to rebound from it. You need to know how it's going to affect your baby. This poor tired little baby with a headache that got jammed through the birth canal, and everybody's wondering why it doesn't have a good latch. Because when it opens its little mouth, its head hurts, people. When the baby was dragged out with a vacuum or pulled out with the forceps, don't you think, isn't it amazing how we don't stop to think, oh, this little kid might have a headache. That hurt.
Yep.
Even if it was to save the baby's life. Let's just say it was totally necessary to get baby out, get everybody born. Now, okay, baby might need craniosacral adjustment now, but we don't want to talk about that because that's woo-woo and it's not scientific. Oh, craniosacral, ooh, right? And I've seen like one adjustment and the little kid's nursing like a champ.
That's right. They snap right to it. Right.
Nursing like a champ.
Yep.
They take a nap, and they snore, little baby snores, and they wake up and they can't wait to get on the movie. And they're fine. They're better. They're healing. But could you just give these poor little shattered babies to their mothers? At least they do get to their mothers nowadays. At least mom gets to hold them right away. They're not often
Right.
every 4 hours, right? But yeah, the baby has to heal up, and then hours of an adult dosage of all these medications in that little itty bitty body. How big is a newborn's little liver?
Smaller than that, probably.
It's smaller than that, yeah. You know, and so just tell people the truth, man. I mean, but the deal is that if they did, a larger number of women would say, held to the know on that. If they did tell them everything, every little thing, a larger number of women would say no, thank you.
Mm-hmm.
So they don't tell them.
No, of course not. There'd be much more home births, even with high-risk women.
And you know, it's a line in the sand who actually is high risk. I mean, that's why.
Thank
You know,
God. Yeah.
it's a different. You know, when you're dealing with, say, African American women. When I was an apprentice with Selena, she would take folks that, you know, were right on the cusp there, and she'd work with them, and she'd help them get better numbers, and she'd get things together.
Exactly.
Between the time they met her and the time they pushed their baby out, they're much healthier people.
Mm-hmm.
But you could be going to your OB's office every week. We just signed new clients. They're in their 25th week of pregnancy. We just did an intake with them this week. And this person said to us, wow, this is the first time anyone has told us anything about nutrition.
Wow. You know, I just talked to my client, she's due in October. Anyway, she has insurance through Kaiser and wants all the information. She's going to have a home birth, actually, probably here in my house.
Yay.
But yeah, right. But anyway, but she's getting her tests and her blood and all that kind of stuff done at Kaiser because she has that insurance. Right. So anyway, so she signed up for a nutritionist. I was giving her brewer's diet and giving her all kinds of information.
Good
stuff. I said, well, what did the nutritionist say? She said, she really didn't say anything. She didn't tell me what I should eat. She didn't ask any questions. And I'm like, wow.
Yeah,
but
that person's getting a paycheck.
Yeah, and that was Kaiser nutritionist.
It's very, very sad. Like these basic things, like where you are emotionally. All folks are doing big emotional processes. If you're African American client, my African American clients, I'm definitely spending a lot of time with them. They're all stressed out. But African American clients who are having sons, their hearts are broken down. It doesn't mean that they're not healthy, but their souls are concerned for their young ones. And just like any other mammal, if you perceive yourself to be in a dangerous environment, labor might not start the way it's supposed to, and labor might not progress the way it ought to. Then you might not have the strength to push the baby out, pushing your baby out into this.
Mm-hmm. Yeah, right. Why?
And so, you know, the big part of what we're doing is spiritual support and spiritual repair. That your baby has a beautiful place here. That you're going to keep your baby safe to the best of your ability. You and your partner are going to do all that you can. That's all you can do.
Right.
And cry with them.
Mm-hmm.
You know? Because they're not going to get that when they go to their OB appointments. And now folks are doing telehealth. And now folks are being told that because they're doing telehealth, they want them to come in for non-stress tests the last three weeks of their pregnancy. I'm like, what on earth? Well, because we haven't seen you in all this time. So now we have to come and inflict this on you in the last 3 weeks or so of your pregnancy. So you can just be totally fucked up. And there's a time when you need to be dreaming baby dreams, you know, making some oxytocin, thinking good thoughts, snuggling with your partner if you have a partner, or being with your family and having everybody being happy that you're having a baby. You're running to the hospital every week. So when they catch the baby on a sleepy day, you can get induced.
Right.
Right. Yeah, or if you haven't had any water to drink and it's hot outside.
That too.
Definitely induce you then.
That too.
Are you just dehydrated? Oh, okay. Well, we can fix that. Like that should be part of our admission questions. What was the last thing you had to eat? when was the last time well, how much did you drink in the last 24 hours? We do ask them, when was the last time you had a poop? Because
Yes.
people like, yeah, you're supposed to poop every day, okay? A couple times a day. How much fiber is in your diet? Yeah. So those are the questions we should be asking people, but we do not.
These basic biological things.
Exactly.
Is the system functioning optimally? Right? Pooping, peeing, drinking, eating, those basic things. And are you eating enough to keep yourself alive and to grow a new human from scratch?
Right.
Did anybody else have any questions? Or comments?
I guess if you could talk a little bit about kind of like what's next for you, Maddy, in your work and what you're doing. Is it just continuing as, more of doula birth worker advocacy? Is there anything coming up that we should know about with the foundation, that kind of stuff? Is there anything you think we should, where should also we be focusing definitely one-on-one with clients and that informed consent, but is there anything else that you'd like to share about that?
Well, in terms of doulas, I would just hope that as doulas, I know Samsarah has you guys reading so much stuff and learning so much stuff, that information gets passed on to your clients, not just, in terms of how you work and knowing pressure points and how to decrease intensity of contractions / surges or whatever, but things like, good nutrition and eating, drinking a lot of water, and the things not to eat as well as the things to eat. And for so many people, it's difficult to have been eating a certain way all your life, and then all of a sudden, oh my God, I'm pregnant and I got to change this. I mean, that's like quitting smoking or something. It's really difficult.
Absolutely.
It's really difficult. And but the encouragement and the support is just something that I personally try to do with my clients, but really strongly recommend that all doulas do with their clients. In terms of the foundation, right now, in the past couple of years, we were doing a lot of panel discussions and showing of the film, and having a lot of midwives and researchers and different people all over the country contribute to the discussion, not just of Cytotec, but of maternal mortality, specifically disparities and informed consent and morbidity. And because of COVID, that has not happened in 2020. And in the end of last year, the end of 2019, my foundation and Healthy Black Families took 12 birth workers and public health people, Tora was one, to Cuba to study the maternal health system in Cuba. And so, first of all, the system is so different. Everybody births in the hospital, that's just a given. But it's the mindset and the perception and how the doctors and the nurses and the families, everybody, deals with not just birth and being pregnant, but cradle to grave. And how they treat each other is one of the reasons that Cuba has so few cases of COVID and just a 2-digit number. I think now it's up to 89 people dying from COVID. And that's not even counting the way that they deal with medicine and the fact that that's free and medical care is free. All of that. Anyway, the things that we learned in Cuba, specifically about MCH, maternal child health, and how they deal with pregnancies with high risk moms, They have maternity houses for high-risk moms where the moms totally get taken care of, both on a nutritional level, emotional support, just absolutely everything. The kids are taken care of. They're fed. They're allowed to totally de-stress in terms of whatever their stresses are from home because they're being taken care of and their kids are taken care of. And it's just incredible. Anyhow, in terms of what the foundation is doing, my hope was when I put this group together that the things that we learned in Cuba for MCH, the people, because most of them were birth workers on hand, hands-on birth workers, either like labor and delivery nurses like Tora, or there was one midwife and a couple of public health people, and the rest were doulas. You know, that we would incarcerate what we've learned in Cuba, in MCH, and in our own personal practices with our clients when we came back. And so I know for a fact Tora's been doing that, and I would just assume that the other doulas, in fact, I know most of the other doulas are doing that also. And the public health people, I mean, but what we came back to was COVID. And so everything was kind of like shifted into a new way of doing stuff. But for me, and Tora, you can chime in on this, please, you know, what we've learned in Cuba in terms of how to deal with something like COVID, I think is very, very applicable here.
Right.
The thing is that the governments and the establishments, you know, don't get that. They finally started doing, what do they call that? Community contact stuff. They do that in Cuba on GP, just generally in medicine.
Right.
You know, they're looking at regions, they're looking at families, they're looking at, you know, people getting certain specific symptoms of whatever, and then immediately they don't wait till 2 million people show up with something. They go in if they see a region where the same type of thing is popping up, you know, and the way they do medicine, they're always asking people what's going on in the house. You know, they just know so much because there's no HIPAA laws. And so it's not weird to tell, you know, whatever, your grandmother, your uncle, your doctor, your neighbor, what's going on. There's not that stigma of health. And so everybody helps each other, and so that's why everybody's so much healthier. Anyway, back to the foundation. That's one of the things that I'm hoping that will come out of that. And the people that we took, certainly Healthy Black Families is also, they've been doing webinars and tying up that with COVID. And I know they're going to do another one actually Friday. And then we're also, the foundation and Healthy Black Families is going to put together a webinar that's going to be in the fall, along with Charles Drew University and some people from public health up at Cal, Dr. Lou, in regards to MCH and COVID and what's going on right now, what we learned in Cuba, and tie all that together in a package. So that's the focus right now for the foundation.
Right. Well, I think one of the things that we learned in Cuba, which was an amazing trip, I'm still like totally blown away by the care that people get.
Right.
Just basic human care for, you know, there's a physician and a nurse who live in the neighborhood, know everybody. So I had a patient, for instance, who came in, she'd had a seizure at home, preeclampsia. She had a C-section for her last baby. Because of preeclampsia, who was a year old, she ended up dying from preeclampsia because she didn't have prenatal care, because she had a 1-year-old, a 3-year-old, a 5-year-old, so, and a 8-year-old and 11-year-old. She already had 5 children, right? So can you imagine her, while her husband's at work with the only car, trying to go to the clinic with 3 little ones. So even if her older children are in school, so she still got the 1-year-old, the 3-year-old, and maybe the 5-year-old to go to the clinic with her get on a bus, get there, you know. It's just, well, in Cuba, she could just walk to her clinic, or she could call the clinic and they would come over to see her. That was one of the things that really impacted me, how just being available for care. If we had neighborhood, there should be no reason why we can't have that same thing here.
That's right.
You know?
Then the postpartum care in Cuba is literally every day for 40 days after the baby is born. The first week is the doctor and the nurse, and from then on, it's the nurse or the community worker going to the house to see how the whole house situation is, everybody getting enough to eat, how's the baby nursing, how's the mom healing, and or, you know, she'll go to the clinic, which literally is around the corner. There's a clinic on every corner. We had one of our participants who was sick, and one of the Cubans who lived across the street in the apartment across the street said, "Oh, the doctor's right here on the corner. She can go see him," you know?
Wow.
Yeah, it was just a trip. But anyway, and then Tora, right? No circumcision?
Oh yeah, definitely not. They do not, you know, well, you
No
gotta,
circumcision.
80% of men are intact in the world. So it's only in America or for religious reasons that men are circumcised. So of course, you know, there's no routine infant circumcision because they want babies to live and grow up and be healthy. And they're sex positive in Cuba also, which I found some videos from the sex center.
Oh, wow.
Yeah, of course they're all in Spanish, so. But there's actually, they have some videos. I think I sent you one or two. But yeah, I'm gonna post them. But they actually, where they talk to people about homosexuality, transgender, and they support and educate the whole country about sex positive, which is so important. You know, we're living in a country where sex positivity is not a thing.
No. No.
And that's
This is interesting information for me, and forgive me for being maybe behind the times on this, but I thought that at one point the Cuban government was not very kind to homosexual people.
No, they weren't. They
weren't.
Better.
But that's the whole thing. The big difference between Cuba and the U.S. I mean, that's one of the reasons we went there is because we couldn't find any statistics. I couldn't find any statistics on disparities in Cuba, because one of the focuses of the foundation is maternal mortality disparities. And so when we got there, we realized that yes, there of course is racism in Cuba, like everywhere else in the world, but they just weren't collecting stats on it. So nobody knew, you know, what the statistics are. However, now they realize that there is racism on the island, and they've started this whole organization that's looking into dealing with the racism to eradicate it. Something that, you know, we still haven't got to. Maybe now we will, but we haven't. But the point is, you know, Cuba has really only been operating the way it is since the late 50s, the early 60s. And we've been here 400 years.
Right.
You know? And they're constantly improving their constitution, you know, basically their Bill of Rights, changing things to fit reality.
Right.
You know.
Yes, because
which is
very helpful.
Health coverage is covered in their constitution. Everyone is entitled.
Healthcare is a right.
It's a right. And education also. Education is a big focus in Cuba. It's the most literate country in the Western Hemisphere.
Wow.
Yeah. And in fact, they had a literacy campaign in the 60s and the goal of Fidel was to have everybody be literate. And they did that in a very, very, very short period of time. And the other thing that's amazing, totally different from here, is that women are lifted up in Cuba because they know that women and children are the future of the revolution. And so they're very well taken care of. They're very well respected. And, you know, jobs are just like no ceiling whatsoever.
Right.
Because that's the future.
Well, that's what sensible civilization. That's what sensible
that makes
society
sense.
do. You know, but when your God is not the almighty dollar, that's what you do.
Exactly. Yeah.
Yeah.
So
Wow. We need to have you both come back and talk more to us about Cuba, because I know we're all interested in that.
Yeah, we
Next time you'll go,
Yeah.
sure I go with you. I can't wait. I would love to go.
Oh yeah, I can't wait to go back. The art, the food, the people. Oh
Oh my Lord.
yeah.
I know.
Pretty
Talk
incredible.
about
The place where people can birth free is such a, you know, it's like talking about an endangered species.
Yep.
You know, someone who's just allowed to imagine of being allowed to just go into labor and give birth with nothing but food and love and water and touch and walking and the birth ball and some chanting, little bossa nova if that helps, and just have a baby.
Well, you know that I found it interesting. I think we were all kind of surprised because when we first went around and all the professors were asking everybody what they did, you know, some people, like I said, we said we were doulas, and they go, "What is a doula or a midwife?" And the concept was just not there because women just do that naturally.
Exactly.
You know, in the family, in the community. You know, it was just, there are no names for that. No, you just birth. We went into, was that a hospital or a clinic? Where the lady, not the maternity hospital, where the lady was getting the ultrasound.
Yeah, that was the genetic screening place.
Oh, that was genetic screening. Oh my God. Then they do genetic screening
Everybody.
really, really, really early. And, you know, when they find something, they tell the mom, they tell the dad, okay, they explain what all that means. And they give them the opportunity to figure out, with all of the positive and negatives, what they want to do. So the abortion rate is very high because a lot of the women, you know, the family decides to have an abortion, because if you have like 5 or 6 people in the family and there's only 1 or 2 working, you know, can you support another child? Can you feed another child? Is that fair to the child? And there's no stigma on abortions, and there's no backdoor abortions like we had to have.
Right.
You know, and might go back into that. But you know, there's none of that because it's all for the betterment of the child and the people that are already there. So it's just a whole nother way of.
And then also the children who do have physical or mental
Oh my God,
or
yeah.
emotional problems, they have special care for them. They have centers, they have daycare centers, they have psychologists, they have everything to help you support your child, whether they have a physical issue, a mental issue, emotional issue.
Yeah.
So that's something that is also something that's so lacking, because how many people have a child who have a physical, emotional issue, mental issue, and they spend all their time trying to find help for this child.
Yeah, they're on their own.
It's there for them.
There's a case that just happened relatively recently that's been popping up because I was watching my true crime stuff on YouTube. And I'm forgetting where it was in this great land of ours, but this mom is facing a huge issue now because she drowned her autistic son.
Oh yes. Was that in Florida?
I'm I'm spacing on it right now. And like, so of course, everybody's hating this woman.
Right.
And it's not okay, of course. I'm not saying people should go drown in their offspring. And what help does a woman get? What help does a family get to raise a violently autistic child?
Right.
Well, you know, in Cuba, like Tora was saying, and we visited this place, the people, what was it, from like 3 years old or some really, really young age, they can come and they can stay there, they eat, whatever. If they don't have family members to take care of them, they can literally live there. And there was this guy there who was what, like 60 something years old, you know, and he had some mental challenges, and they called him the ambassador. He'd been there God knows how long. But the point is that they take care of their people. So I didn't see any homeless people on the street. I mean, if there is, there's no encampments. I guarantee you that. I mean, there might be homeless people because that's just life, but there are no encampments.
Right.
And it's
and they're not. And you know what? If they are homeless, it's not because they don't have physical care, mental care, emotional care.
Some people like to be out. I mean, the weather's nice in Cuba.
Weather is nice in Cuba.
Some people might choose to be out. But let's come back to our topic, because I'm getting like.
Yeah, I was gonna say they do use Cytotec. They do inductions, and they do use Cytotec because I asked them, and when I gave them some of the side effects of that, they were like really, really surprised. So for whatever reason, whatever way they use it, you know, vaginally or orally, apparently they don't get the morbidity that we do.
I would imagine the physical health of the women being stronger.
Right.
I would imagine that, because unfortunately the average American woman's diet is crap. It's, you know, it's horrible.
Right.
And, you know, I don't know like the median age of the first time mom in Cuba, but our moms are a little older and have had a longer time to have a crappy diet and all this other stuff. And so they pull it together for the pregnancy, and then they might get to with a doula like me and get information and start eating better. But then that's just a few months out of their whole life.
Right, exactly.
And then that medication hitting that body. And if you are, you know, overall, you've had a kind of undernourished body. You've been eating fruity Oreos for 30 years, and then you have a baby, right? The outcome can be very different.
Yeah.
Right. Exactly. And it is, I think.
Yeah, you're not going to find a lot of McDonald's or Burger King or those kind of foods in Cuba. So that, and plus, you know, people are followed from birth.
Right.
Their health. So we already know that if there's a family inclination to hypertension, for instance, or anemia, that is they already know that about that person. So
don't mess with it any further by, you know, eating garbagey food if you can find some, right?
Well, they get the whole nutrition thing from Jump Street. So it literally is a cradle to grave health system, you know, and tracked that way. I don't know if you're familiar with Michael Liu's, you know, Michael Liu is just amazing. He's the head of public health now. He used to be down the head of public health and maternal child health down at UCLA. Yeah. And so anyway, his whole thing also is here, because that's not common here, you know, is that people should be eating healthy, specifically women, way before they get pregnant. So just like you were saying, you know, their bodies are stronger. And, you know, hopefully, I mean, they have a food shortage now, but, you know, they pick and choose the food. So the McDonald's and the fast food things don't really exist. The things that are there are at least healthy food, if you can get it.
Or food that you grew in your garden, or, you know, the chicken that you killed this morning. Sorry, Tora, I know that that's not my beautiful vegan. She's like, stop talking that crap.
Yeah, well, you know, that you can go out and pick some avocados off the tree in the backyard.
There's your protein.
Right. Yeah.
Yes, ma'am. Anyone else have a question? I see things popping up, and it's like Jocelyn, go ahead.
I have a question, and so maybe this is something you saw in Cuba, maybe not, I'm not sure. And I'm asking because the only time I've seen Bay Area staff really like titrate a misoprostol dose where they did like a much smaller starting dose was when somebody had a stillbirth and they knew that, and they were trying to be as gentle with the mom and her experience as possible because the baby had already passed, and so they didn't have that other liability, and they were just like trying to do, with unknown reasons for stillbirth, like trying to do it very safely. So they used a very small amount of miso. When you were in Cuba, did you find that the ways that they were using it, if they were using it all with all that information about their family, with all that information about their community, when they did use an intervention, and I don't know how up close you were they much more customized and specific with how they applied those interventions because of that?
I personally only asked them about the Cytotec. If I don't think they talked a lot about induction. You remember that, Tora?
They talked a little bit about it, especially if somebody gets to 42 weeks.
Well, 42, yeah,
42
but I mean, certainly not 39, and
No,
not for
no.
all, you know, the reasons, ski trips and things like that they do here.
Right.
But, you know, the Cytotec was the only one that I asked them about. I didn't ask them about any of the other types of induction, so I honestly don't know.
Right.
I would seriously doubt that they have Cervidil because it's very expensive.
Right.
Um,
They might
know.
have like some kind of progesterone
Gel.
You
Yeah.
might be able to get something like that. And they use a whole lot of homeopathic.
Yeah, I was just gonna say, yeah,
they
yeah,
use a lot of homeopathics.
Right.
yeah.
So
And those suckers are good. They work. There's not a side effects. They've
right.
been used for forever.
I find it interesting that because the few times that I've taken care of a patient who had a fetal demise, we actually give them a lot of miso.
Mm-hmm.
Maybe it was a one-off, I don't know.
Right. Well, and because you're not worried about the effects on the baby.
Exactly. I was working at San Francisco General at this one night, and there were two women. They were 24 weeks. They both came in separate sides of the city, both Latino women. They both had this weird ass discharge, and they both had stillborns. One aborted naturally, and the other one they induced to abort. And I never knew, because we were working more with the moms and their feelings than
Right.
I was asking, well, what are you using and how long is that going to take? The one that they induced had baby quicker, and obviously the one that just did the natural abortion took longer. But I don't know what they used or how much they used. Like, I don't remember a drip, so I don't think it was PIT.
Right.
Most likely was Cytotec.
Most likely.
And that's another thing too. Like, it could be, the care is so, this could be such a, there's no like one standard of care.
No.
So different shifts and different hospitals, it could all be so different.
Right. Different doctors.
Different hospitals. Because usually what we have is protocols for medications like Pitocin and misoprostol that are standard throughout the hospital. So it's going to be the same regardless of the physician or the midwife or the nurse. But a different hospital might have a slightly different protocol, but it's not going to be too much different, because we have seen especially with Cytotec, that less is better.
Right.
Yeah.
Right.
None is best.
None is best. But that's not going to happen anytime soon.
Can't do none.
I know, but I'm just saying.
I know.
And especially, as I said earlier, especially when we're talking about perfectly healthy people, when
Right.
there's something going on, then there's something going on,
Right.
you know. And then, you know, if somebody's already lost their baby, then, you know, I would like to think that we're riding through misoprostol contractions for stillbirth. That breaks my heart even thinking about that. That must feel horrible.
Well, I can tell you that most patients who have a fetal demise, their pain management is a high priority. So they're much more likely to get either IV medications or an epidural earlier rather than later.
An epidural?
Sure. Depending on
It's like trying to, I would imagine it's like trying to numb the pain of the whole thing.
right. Yeah.
Because you're not going to walk away with a live baby. you know?
38 with a fetal demise. Yeah.
Wow. Wow.
But that's the other thing. We're seeing more with COVID. We seem to be seeing more fetal demises with COVID.
Really?
Funky placentas.
I was reading that.
Patients who are positive have these crazy placentas with a lot of infarct and clots and those kind of things in them.
So these are mamas who test positive, obviously.
Right. And we're testing all people, all women who come in labor, who are admitted, they're all tested.
Yeah.
So I encourage you as doulas and support people to just tell your people to go ahead and get tested, because if they don't get tested, they're treated like they're positive.
Right.
So,
Right.
you know, it's the trade-off.
Yeah, I mean, it's a good thing for folks to know. I mean, I think at this
Yeah.
point, and what's
Anybody here had a
interesting,
test? No? They look horrid. Like,
Mika, did you have your hand up?
did you have one?
Yeah, I got tested.
How was
I was doing my labor breathing through it, I must say.
Labor breathing helps you through your whole life.
It was doulaing
does.
myself
It
through that
does.
experience. But I've
does.
heard that at least if you're in Oakland at the West Oakland clinic, that they're doing, the swab that they're doing is not that really deep one.
Into your brain? Yeah.
It's not quite as painful. So the next time I get tested, I'll go there for sure.
Okay.
I got tested at Carbon Health, and there's one in Oakland and Berkeley, and they take any insurance and no insurance, I believe, and they did a shallow one too.
Right.
So it wasn't so bad.
So Tora, let me ask you this, and this is about the COVID test. If somebody gets tested, I don't know, like what is this, June? If somebody gets tested in the middle of May, and then they come in labor in the middle of June, do they have to test them again? If they came out negative in May, they're going to test them when they walk in the door?
If they're admitted, yes, then they're tested again.
As soon as they walk in the door, if they're admitted?
Only if they're admitted, yes.
Even if they bring in a document saying that they had been tested, I mean, they could have been exposed in the meantime. I get it.
Right.
Right. Wow.
Okay. Any more questions and comments? Doula people, guest people.
Well, I really thank you, Samsarah, for doing this. Just number one, because I thank you from the bottom of my heart for Cytotec and the induction and all the information that you're passing out to your clients, but also your students, but also because we got a chance to talk about Cuba. And that's the whole really, and with inductions and MCH and everything, that was one of the whole purposes of that trip for that lady that asked what's the foundation doing. So I appreciate, the opportunity to do that.
Well, you know that you're my heart, girlfriend, and
thank you.
It's so true. For a long time now, we've known each other, and we have to keep this information out there. And I'm doing a lot of this stuff to keep myself from just kind of jumping out the doula window, because it's very frustrating right now.
It is. Don't do that.
The work that I know that I'm really good at doing, and watching my clients have a result that I feel very certain that if I was in the room, the result would have been different.
Yeah.
That's very painful. So my therapist is on speed dial with me. I'm having 2 therapy sessions a week behind this stuff. So in the meantime, I don't know if we can reach out to the resources of the foundation. If you could send out an email asking your folks to call the governor and have him do what the New York governor has done to declare birth doulas essential workers. Do you know postpartum doulas
Yes,
are essential
yes,
workers?
yes.
Do you know that postpartum doulas and nannies are essential workers?
I didn't know that, but I
They
I
are.
did know about New York. And actually California is trying to get a bill passed that basically says that and pays doulas, and it has a whole bunch of stuff that we've been
I
trying to
thought
get
that
through
was
for a long time.
tabled. I thought that bill. I thought that bill was tabled, like right
It
after.
was. That's what I'm saying. They were working on it, and they had to stop. So, but it's not going to go anywhere. Believe me, it's going to come back.
We better.
No, it will. It
In the
will.
meantime,
It
we
will.
need to bug Newsom because this is ridiculous. We're health workers. We're holistic health workers. We should be doing our work.
Right. Exactly.
Except that some greedy people don't like doulas doing their work.
Oh.
Highland Hospital has reopened their doors to doulas.
Yay! That's awesome.
Yeah, Highland actually has gotten so much better than the first time I was there, which was years ago.
We got a lot of nurse midwives there.
They do.
The brown ones.
They do. They do. And
Brown
they're
nurse
changing
midwives.
policies a lot more towards the midwifery model of care, a lot faster than the other hospitals. I mean, I've seen, some stuff in Alta Bates and some stuff in Kaiser, but I've seen actually much more in Highland, probably because they can't afford the things that Kaiser and Alta Bates can afford, but that's a blessing in disguise because they have less C-sections. All their rates are better.
Well, see, that's the whole point. That's why the whole rest of the world that does single payer has midwives delivering the babies because they're cheaper. It's not because patriarchy gives a darn more about women in those countries. They're cheaper than having a trained surgeon just deliver a baby.
And they provide the care that these women need.
Exactly.
They don't need a doctor to provide care for them.
Yeah.
When they get a doctor, they transfer that patient to doctor care.
Exactly. So, billions would be saved if folks were, if the majority of American women were birthing with midwives.
Yeah.
Billions.
Stop
In
it.
any case. So we got time for one more question or a comment or a statement.
No? Okay. Well, one thing I can say is that, because I teach my nursing students maternity, the book that we actually use actually talks about how Cytotec is not approved for labor induction. And
What book is that? What book is that?
It's the pharmacology book. I have to go downstairs to look at it.
That's great.
It's very clear about that, and it's in their notes. And I actually have found that I have an old package of Cytotec. Remember when this package actually had a picture of a pregnant woman with
The circle and the X through it?
Right. I still have one of those, and I use
Oh,
them
man.
in my class.
Take a picture of it and send it to me. All right. Take a picture of it and send it to me. I wish I had kept one of those suckers. They hide them now.
Oh, they don't. No, they don't make them anymore.
Yeah.
They don't make the Cytotec is just like a regular little pill.
Goodness.
Yeah.
So I want to remind our visitors that your visit with us, this is part of the fundraiser for Oakland Better Birth Foundation. If you can make a contribution, please do that by PayPal at oaklandbetterbirthfoundation@gmail.com. That would be great. This is taped, so it'll be on the Oakland Better Birth Foundation's YouTube so that we can share it with clients and we can share it with other new students coming on board. We want to mention the Tatia Oden French Memorial Foundation. What's your email, Maddy?
The website or the email?
The both.
Okay, well, the website is www.tasha, which is T as in Tom, A-I-T as in Tom, Tatia.org. And on the last page, there's a contact us. And if you just, fill it out and hit send, it comes directly to me. So
That sounds great. Do you have a donate button on your website?
we do.
Please, please, please
We
share
do.
information about the website around and request for folks to donate to the amazing work that's being done by this powerful mama in the spirit of her beautiful daughter and granddaughter.
Thank you. Thank you.
Very, very, very welcome. And I would like us to, before we close our time today, is to have a moment of silence because we want to have a moment of silence for George Floyd. We want to have a moment of silence for the other folks that have been killed via police violence. And the most recent gentleman in our area, Eric Salgado, who was killed this weekend. And I want to express some personal fury about the fact that he was shot. He was in the car with his pregnant partner. He was shot and she was shot in her belly. I cannot for the life of me find her name, and I cannot for the life of me find out her status as to somebody said she lost the baby, but I have been searching and Googling and I haven't gotten any of that information. I'm really angry at the media erasing this woman. I'm assuming a woman of color. I could be wrong about that, but it doesn't matter, right? We're erasing her, I do believe, because folks don't want any more big demonstrations. We want things to calm down. And so we're just going to forget this pregnant woman is in the hospital and may have a dead fetus. So I want us to have a moment of silence. Even though we don't know her name, we love her and we're sending her power and we're sending her healing and we're hoping that she gets to keep her little one and go on and have a healthy, beautiful life. And if she's lost her little one, we want to give her strength to survive such a horrible thing at the hands, again, of some freaking cop. Give me a break. So if we can just have a moment of silence. So thank you all for that. Thank you so much, Maddy. Thank you so much, Tora. We should have you as an extra special guest.
Yeah, well, I had 3 Zoom meetings tonight, so.
Girl,
This is why I was
thank you for being with us, adding so much to the conversation. And okay, beautiful doulas, have a wonderful week. I'll see my people next Tuesday. Peace and baby blessings.
Stay safe.
Thank you so much. Good night.
Good night.
Bye.
Bye. Bye.